And you start with the physio here, don't you? And then obviously there's, like you refer to our clinic, but other clinics as well, to get that knee moving.
Yes,
as quickly as possible.
Absolutely. So you've got inpatient physiotherapy, of course. Our average length of stay, I think, is a couple of days.
Yeah.
I think about 2.2 days.
2.2 days.
You can send people home early.
It used to be about 2 weeks when I was in the NHS, about 15.
Well, it used to be. I think that's come down, to a lot across the UK, and something we do well, I think, in the UK. But of course, you want to get the balance between pushing people out of hospital and making sure they feel cared for. And so all our patients will go up and down stairs the next day and then be ready to go home.
Like, what are your general expectations, including range of movement, from one of your knee replacements?
Yeah, so again, I think it's true to say that what I've expected from my series of 5,000 knee replacements to date and increasing, it has changed over the last 15 years. What I thought was good or acceptable 15 years ago is not what I think of today. I mean, I expect 70% of my patients to be driving at 2 weeks as soon as the wounds have healed. I expect a good and early recovery of range of motion. There was a time when we thought 0 to 90 degrees of movement, the 0 to 90 knee was a good knee. That's a terrible knee. You need natural movement, and I would like 0 to 130 degrees minimum. But of course, the robot has educated me. Some people get to 155 degrees, and
because you do it in surgery, don't you?
Because you can see the range
when
of
they're
motion.
asleep and relaxed and not in pain, you can physically see how far that knee replacement will go.
Exactly, and then there are certain ethnicities, for instance, who have looser joints. So your Middle Eastern patient or your Far Eastern patient, often they would want to re-achieve. They're much more flexible than the Caucasian knee. And so you're trying to give people, the holy grail of knee replacement surgery is to get a natural feeling knee. And if one day they could forget that you've done it, that would be the biggest compliment.